Hello and welcome to the award-winning Waterman Wellness, your pathway to health and wellness with local experts as your guide. I'm Michelle Wargo. Here's a look at some of the stories coming up in this episode. If you have a tendency to overeat during the holidays, you'll want to stay tuned. A local specialist will explain why your symptoms of indigestion could be something more serious. How can you put your best foot forward in the new year? You may be surprised to learn how genetics and shoes play a role. And find out about national recognition one Lake County hospital is receiving because of its patient care. A local hospital is celebrating a first for Lake County that is especially good news for cancer patients. Last month, Florida Hospital Waterman performed its first stereotactic radiosurgery on a local patient.
So stereotactic radiotherapy, sometimes referred to as stereotactic radiosurgery, is not a surgical procedure. But it is a radiation therapy procedure that allows us to deliver high doses of radiation very precisely to small tumors. The area that we're working on right now is the brain. And the upgrade to this piece of equipment now allows us to treat a small population of our patients with this special technique. Up until now, those patients would have to travel down to Orlando or up to University of Florida to have this treatment.
For appropriate patients, the stereotactic radiosurgery can significantly improve patient recovery.
It's important for the community to realize that Florida Hospital Waterman has state-of-the-art technology. This type of treatment is more beneficial for the patient radiobiologically. It has a greater effect on the tumor, but it's also more convenient for the patient because they can come for 1 to 5 sessions versus traditional radiation therapy where they have to come anywhere from 2 to 10 weeks.
Florida Hospital Waterman is accredited by the Commission on Cancer of the American College of Surgeons and is the only cancer center in Lake County offering this specialized treatment. Advancements in cancer treatment are good news for patients like John Spadaro of Eustis. The retired firefighter found out he had prostate cancer in February. The diagnosis came after Spadaro requested a PSA test because both brothers had the disease.
My general practitioner found out through a PSA test that my PSA score was 4.2, which I came to understand is a little bit elevated.
Spadaro went to urologist Jason Gerbach, who conducted a biopsy.
The biopsy is very frightening when you talk about it, but the actual biopsy itself is a little uncomfortable. But it's on a scale of 1 to 10, I'll give it a 4. It's not that bad.
Dr. Gerbach recommended Spadaro have surgery to remove his prostate because of his relatively young age and good health.
I went back to the surgeon after about 2 weeks to check with him. The doctor told me at that time, he said, you have a 40% chance of actually reoccurring cancer because of the positive margins. I heard him, but it didn't register. I went to my urologist for another minor problem, and it was something not really related to the cancer. And in the process of talking, he asked me what I was going to do. And he says, well, you still have cancer. And you could have picked me up off the floor. I mean, you could have knocked me over with a feather. And I thought, you know, I had the surgery, I'm done. He says, yeah, you had the surgery, but you still have cancer cells. And the light bulb kind of went off.
Understanding he would need radiation treatment, Spadaro contacted Anud Jain, a radiation oncologist at Florida Hospital Waterman.
I was very encouraged by him. He's a nice fella. He seems very bright. It seems like, you know, I saw the equipment they had. They have state-of-the-art equipment. And I even asked him, I said, what makes you any different than any other cancer center? And he said, we're as good as any. And he says, we have the same machines they do. We have the newest machines. We have a very knowledgeable staff.
With image-guided radiotherapy, our treatments are becoming more accurate. Patients have images taken on the treatment machine to make sure their treatments are as accurate as possible. This results in greater precision of the radiation therapy for the patients and less dose to normal tissues, resulting in less side effects.
The whole process for me here at the facility that I'm at Waterman has been very good. It's been positive. And the biggest part of it has been the people that I've been dealing with. They're very kind people, and I'm very grateful they've been there to buoy me up with them and my wife and my family. I was a firefighter for 34 years. Being a firefighter is very empowering. I got knocked off my pedestal big time with this problem because it made me very mortal.
Because during early disease, there aren't many symptoms. It was only until the advent of PSA in the late 80s and the early 90s that we started detecting prostate cancer early. Prior to that, patients were already detected when they were metastatic and that there wasn't much more that could be done for them. Often it meant pretty bad death.
You got to pay attention to what your family history is, and if you have any indication at all that things aren't right in reference to cancer, you need to get it checked out. You just have to, for your own good.
If you or a loved one would like to learn more about prostate cancer diagnosis and treatment, visit fhwatermancancer.com. Our next story is about another significant accomplishment for Florida Hospital Waterman. The hospital has received an A grade for safety from the Leapfrog Group. This national recognition is not the first for the Tavares medical team and staff.
As an external reviewer, they give information back to hospitals that say who's doing a good job and where do we have opportunities for improvement. We have been, up until this year, the only hospital in Lake County that has received an A grading. We now have other hospitals now in the county that do have an A grading, and that's a good thing. That means that the quality improvement efforts is improving across the hospital community for patient safety. This is our third year in a row of receiving the A grade, which it means that we're consistent about making this an important quality measure and outcome measure on behalf of our patient and our community.
More than 2,500 U.S. general hospitals were assigned scores in October of 2015. Of those, 773 hospitals received an A grade. It's time to take a short break, but we'll have plenty more when Waterman Wellness continues. We'll head to the Conry Creation Health Center, where Chef Dave has a side dish recipe that will surely become a favorite holiday tradition. A Mineola woman is living pain-free after a procedure to correct a foot deformity. And a local cardiologist has helpful tips you'll want to know if you plan to start exercising in the new year. You'll find additional health and wellness information in Waterman Wellness magazine. Visit watermanwellness.com to arrange for home delivery, and you'll also find a listing of the specialists featured in this month's episode. First, Waterman Wellness has information about upcoming events you might want to note. We'll be right back. Welcome back to the award-winning Waterman Wellness. I'm Michelle Wargo. It's the end of the year and a good time to consider your health now and in 2016. Doctors know many of their patients plan New Year's resolutions, and they want to encourage everyone to work toward prevention of medical issues.
The first most important intervention that you can do is still lifestyle modification rather than medicine. If you look at the entire population, the total percentage of people that actually engage in daily or weekly regular exercise on a long-term basis is actually very, very small. If you exercise, you make sure that you're able to sustain it long-term. All of us are very good at starting exercise and do it for about 2 or 3 weeks, and then we stop doing what we did. A lot of times it's just having unrealistic expectations. So it's really trying to find a level of exercise that you're willing to stick to and comply. There's not one exercise that's better than another, so long as you achieve some sort of anaerobic quality. If you look at a lot of the data, it tells you that you should try to do something of an aerobic nature, probably at least 5 days a week for 30 minutes continuous. But if you can only do it 3 days a week, you're still doing better than a good percentage of the population.
Experts recommend consulting with a doctor to make sure you've chosen the correct exercise regime. Visit the website to find a doctor who can help you. If exercise is part of your plan for the new year, be sure that you put your best foot forward first. Feet are important in every way to get around, but we don't always treat them with the respect they deserve.
Basically, we have 26 bones, 33 joints, over 100 ligaments and tendons in our body. So we need our feet to just do anything. When your feet hurts, everything hurts.
I'm an avid exerciser, taking group exercise classes. I love to get on the soccer field with my 12-year-old son, and the pain was so bad I wasn't able to participate in those activities.
Ladner, who lives in Mineola, consulted with Dr. Balkaran, who determined she needed a complex bunionectomy.
So bunions are most times genetic deformities. And what causes them to get worse over time, the progressive deformities that get worse over time. So if you do nothing, they can become very severe or they can stay one level. What makes it worse, maybe exercise, into the wrong shoes, wearing different shoes, wearing tight shoes, and maybe a lifestyle if you're on your feet a long time, that, putting a lot of stress on the bunions.
My toe was short, as well as having the bunion that was protruding off of my big toe. So it was a little more complicated than just a run-of-the-mill bunionectomy. She had to remove the bunion as well as elongate the toe. My recovery was fabulous, and it's because I followed the instructions that Dr. Balkaran had given. Getting it done sooner, you're going to avoid any lengthy recovery. You're going to avoid any pain.
Dr. Balkaran says the first step to preventing foot problems like Ladner's is knowing your feet.
So just figure out what type of foot type you are. That's number one. What type of activity you want to do. So different activities require different shoes. Unfortunately, one shoe will not, get through with everything. If you're a runner, you need special running shoes. You need to get the shoe type that matches your foot type. And secondly, you need to get the right type of shoe sizes.
Also, Dr. Balkaran recommends stretching when you exercise.
Typically now, most exercise physiologists agree that you want to do a warm-up, a mild jog, a brisk walk, and some jumping jacks, and then get your body warmed up and stretch. The Achilles tendon is the most understretched tendon in the foot. It perpetuates most of the problems in the foot.
You'll find specialists who can help you step up your exercise regime by visiting the website on your screen. We now turn to another health concern that could affect many during the holidays, and it stems from our tendency to eat a lot. Faced with parties, family get-togethers, and plenty of sweets, it's hard to say no. Aside from the potential for weight gain, Lake County gastroenterologist Harsh Tavares is concerned about a medical condition that many ignore. And it is likely to be aggravated by rich holiday food.
Usually people present as heartburn, indigestion, having bitter fluid in the mouth when they go to sleep, wake up in the morning. These are the common symptoms of acid reflux. Several things can lead to it. The common lifestyle predisposing factors are being overweight, eating large processed meals, smoking, not exercising. The unusual symptoms are having chronic cough, having hoarseness of voice, having bronchospasm and wheezing, and then bad taste in the mouth, what we call halitosis, bad breath. These can all be related to reflux. And people can have these symptoms without having heartburn and indigestion.
While sometimes difficult to diagnose because of these uncommon symptoms, Dr. Tavares says acid reflux is easy to treat.
They have very effective drugs. People no longer need surgery. Most of the times people need it for the life, but if people stop smoking, lose significant weights, become active, change their eating habits, people go off drugs. I've known it in my practice, yes.
If you suspect you have acid reflux, you can find a specialist to help by visiting fhwaterman.com. How can you make your holiday meal healthy for you and your family? We head to the Conry Creation Health Center kitchen for a recipe that is healthy, filling, easy, and you might want to make it year-round. If you're looking for that something special and delicious to serve at your holiday dinner, Florida Hospital Waterman Executive Chef Dave Atkinson and registered dietitian Stephanie Bassett have just the thing, and it comes in its own serving vessel. So your guests are going to want this recipe. What is it?
We're making a roasted acorn squash with wild rice and a pecan stuffing.
Ooh, what goes in it?
We have our acorn squash that we're going to roast in the oven with a little maple syrup. And then we're going to make a stuffing with wild rice, celery, dried cranberries, pecans, onions, and some seasoning. First thing we're going to do is mix our olive oil and our maple syrup. And we've taken our squash and cut it in half and scooped out the seeds. And we're just gonna drizzle some of this maple syrup and oil inside there. And then we're gonna roast this for about 30 minutes.
So while that's in the oven, why is acorn squash good for us?
It's a really great source of potassium and vitamins A, vitamin C, and then fiber as well. And this is a really healthy alternative to like a traditional holiday meal that you would serve at a party or a dinner.
And it sounds like it's going to be filling with all the stuffing too.
Yes, it's going to be a very hearty meal, and it's all in one serving vessel.
Yes, I love that. All right, so what else do we have to do while that bakes?
Okay, while the squash is baking, we're gonna saute our vegetables. We have some onions and celery. And while that's finishing, we'll go ahead and add the rest of our ingredients to the bowl. We have cooked wild rice. So we've added our dried cranberries, chopped pecans. We have thyme. This is dry thyme, but you can certainly use fresh thyme. And then a little bit of balsamic vinegar. Okay, so our vegetables should be nice and tender now. We're just going to fold those into the rice mixture. We're just going to give it a quick toss. So let's go check on our squash and see how that's going. So it's been about 30 minutes. Squash is nice and golden and soft. And then we're simply gonna...
Oh, so you don't mash it up or anything?
No need to mash it.
That's good. Should I try it? That is really good. It tastes like the holidays. Good job, Dave.
Thank you.
If you'd like the stuffed acorn squash recipe, visit watermanwellness.com. We hope you've enjoyed this month's episode of Waterman Wellness, your pathway to healthy living with help from local experts. Be sure to watch for the January episode right here on Lake Sumter TV for some of the following stories. A local woman shares how her decision to have breast reduction surgery eliminated chronic pain she'd experienced for years. You'll find out about a new procedure that can help some sufferers of arthritis pain. And a Tavares family shares how a local medical team helped them through a frightening scare with their newborn. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Michelle Wargo for the award-winning Waterman Wellness.